Hello, I'm Dr Sireesa Yareeda, Additional Professor, Department of Neurology, Nizam Institute of Medical Sciences, Hyderabad. Today we are here to explain about Parkinson's disease on the occasion of World Parkinson's Disease Celebration Month, which is April. Basically, what is Parkinson's disease? Parkinson's disease is a symptom constellation where patients can have tremor, they can have stiffness in the limbs, or they can have slowness on all activities, or some gait problem and speech problems. So what is this tremor? So there can be erratic movement of hand or leg which will interfere with their day-to-day activities, like they're not able to feed with a spoon, or they can't mix food properly, or while walking there is disabling tremor which is interfering with their activities. Like that, they can also have slowness in all their activities, that is to do day-to-day activities like even bathing or walking or like eating and all. So everything becomes extremely slow. Similarly, they can have gait problems, that is they walk with a peculiar gait where they are bent forward and they take short shuffling steps. There is a tendency to fall, and they can also have speech problem where the voice becomes very slow, muffled, and it is inaudible. So these are some symptoms which can be seen by other people. These are called the motor symptoms. Similarly, patient can have several non-motor symptoms which they are suffering, but they are not evident to other people nearby, which are called the non-motor symptoms. For example, they have severe sleep disturbances. That is, they are not able to fall asleep after 2 or 3 a.m. in the midnight. So it is very severely disabling them. And in the morning, they can have excessive daytime sleepiness. They can also have a lot of psychiatric disturbances like anxiety or depression, or they can have psychiatric disturbances like hallucinations and delusions. That is, they see some people around them, or some people walking, or some thieves are trying to enter the house, which causes them to be extremely worried about. So these are called the non-motor symptoms of Parkinson's. So if your family member, or if somebody in your neighborhood or a known person is having so and so set of symptoms, it is a suggestion that probably it is Parkinson's disease, and there is a need for you to seek medical attention, because there are several treatment options available for Parkinson's. So one is, once the diagnosis has been made and confirmed, then there are trial of medications like levodopa is one of the drugs. In addition, there are a lot of other drugs, apomorphine infusion therapy and all. So the best medical management can be tried. However, the problem with this levodopa therapy is it might cause severe extra movements which are called dyskinesias. Sometimes the medication induced side effects are so tremendous, they're so disturbing that the patient cannot take the treatment also. In such cases, if the patient has a more than 4-year history and he's responding to levodopa therapy, but he's having undue side effects to the therapy, he becomes an ideal candidate for a surgical option. So what are the surgical options available for these patients? One is deep brain stimulation. Deep brain stimulation therapy is rampantly used since almost 25 years in carefully selected patients. It's FDA approved. There are evidences that it improves the quality of life significantly. There are other surgeries like lesionectomy, like ablation therapy of some of the important tracts which are responsible for the disease. However, the advantage of the deep brain stimulation surgery is the reversibility. That is, once the electrodes are placed in selected areas of the brain, and the stimulation is done with a battery which is placed on the chest wall, and in the follow-up visits, once the surgery is done, the physician will adjust or program the current to get the desired effect and to avoid the side effects. If needed, the adjustments can be done fine-tuned so that the side effects are minimal and the effect is grateful. However, the lesionectomy would be a permanent procedure. However, in carefully selected patients, DBS can be done, and it's proved beyond doubt that it is very efficacious. So there is a need to not anticipate the fear for being a surgical procedure, but there is a need to say yes to DBS in carefully selected patients. Thank you.
Say yes to DBS.